My name is Gautamavan Manoj and I will be presenting our project for the hackathon. Drug addiction is a common and persistent problem which is complex and often chronic, and it is a brain disease. It is characterized by drug craving, seeking, and use that can persist even in the face of devastating life consequences. If a person is compulsively seeking and using drugs despite negative consequences such as loss of job, debt, family problems, or physical problems brought on by drug abuse, then he or she is probably addicted. Addiction results largely from brain changes that stem from prolonged drug use, changes that involve multiple brain circuits, including those responsible for governing self-control and other behaviors. Mental health conditions such as depression, post-traumatic stress disorder, and anxiety are also factors that contribute to substance abuse and addiction issues. People use drugs and alcohol to cope, but substance can actually increase depression and anxiety. Drug addiction is treatable, often with medication, combined with behavioral therapies. However, relapse is common and can happen even after long periods of abstinence, underscoring the need for a long-term support and self-help. Relapse does not signify treatment failure, but rather should prompt re-engagement or modification. If and how quickly one becomes addicted to a drug depends on many factors, including one's biology, age, gender, environment, and interaction among these factors. Vast differences characterize individual sensitivity to various drugs and to addiction vulnerability. While one person may use a drug once or many times and suffer no ill effects, another person may overdose with first use or become addicted after a few uses. There is no way of knowing in advance how quickly one will become addicted, but there are some clues. One important being whether you have a family history of addiction. Drug addiction can effectively be treated with behavioral therapies, and for addiction to some drugs such as heroin, nicotine, or alcohol, medications are used. Treatment will vary from each person depending on the type of drug or drugs being used. Multiple courses of treatment may be needed to achieve success. Applying estimates of prevalence to population figures, a survey estimated in India, whose population is just over 1 billion, that 62.5 million people use alcohol, 8.75 million use cannabis, 2 million use opiates, and 0.6 million use sedatives or hypnotics. 17% to 26% of these people can be classified as dependent users who need urgent treatment, says the report. And while people who are addicted may believe they can stop at any time, most often they cannot and will need professional help. First to determine if in fact they are addicted, and then to obtain drug abuse treatment. About 25% of users of opiates and cannabis are likely to seek treatment, while about 1 in 6 people who drink alcohol are likely to do so. This accounts to a very small percentage of users. Thus, taking all this into consideration, we as a group have come up with an application that acts as a questionnaire to assess how deeply the user depends on whichever drug or drugs they are taking, and also provide them with appropriate helplines and resources they can use. We will be implementing this by manner of a questionnaire that is well-rounded, inclusive of all substance abuse to provide the user with an assessment of their condition. The questionnaire will be answered anonymously, that is, it will not bear any identification to the users to guarantee privacy. The application will further guide the user to help they may require according to their proprietary needs. This could range from contacts for the nearest support groups, Alcoholics Anonymous, Narcotics Anonymous, counselors, psychiatrists, or any further help that could be suggested. Thank you.